been a possible breakthrough in the early detection of Alzheimer's and other dementias.
It's actually a simple, inexpensive test that can be given right in the doctor's office. CBS 2's Dr. Max Gomez here to tell us this involves the nose. Doctor.
That's right. It's a smell test, but it's not whether you can smell something. That's a nose issue. It's about how your brain processes and remembers certain smells or odors. A new study shows that a simple scratch and sniff test is pretty good at predicting who's going to develop Alzheimer's as much as 4 years later. When doctors told Pansy Green that she was in the early stages of Alzheimer's disease, she was just 69.
I got lost when I was going to the store, and I couldn't find my way home, so I had to call Winston and have him come pick me up.
For the more than 5 million people in this country like Pansy with some form of dementia, knowing early on would allow them to better plan their remaining years and perhaps take part in clinical trials that might slow the progression of the disease. But present early detection tests like a PET scan or a spinal tap are very expensive and invasive and often not covered by insurance. Now a study of 400 normal adults presented today at the Alzheimer's Association International Conference in Toronto. Columbia University Medical Center scientists showed that a simple smell test called UPSIT may be just as good as those other technologies.
The UPSIT that can be performed in an office setting very easily. It takes about 20 minutes to perform. It's a 40-item test. Costs $20 to buy the kit.
UPSIT, which stands for University of Pennsylvania Smell Identification Test, asks patients to identify certain odors from multiple choices, to remember that they've smelled it before, and to identify the thing that's associated with that odor. Brain scans of the study volunteers showed that poor scores in UPSIT were as good or better predictors of dementia than the scans. But what's so special about smell?
The very structures that these brain cells are projecting to in setting up the olfactory system in the brain are the same areas of the brain that are affected early on in Alzheimer's.
Now, it's the change or deterioration in your ability to smell and interpret odors that may predict future dementia, because a lot of people start out as poor smellers, smokers or brain-injured people, for example. And doctors hope to be able to follow normal volunteers for much longer times to see how early the smell test may be predictive.
Wow. So it sounds like we can get this test now. How do you go about doing it?
Well, it is available now. It's about, if you're buying it just one or two at a time, it's about $30. You can get it on the internet. You can take the test. What you have to be careful about is how you interpret that test, because no test is 100% accurate, rather. So you want to take it and then make sure that you have a way to, or a physician that will help you interpret what that test means, so that you know it doesn't mean that if you can't smell certain things, you're definitely going to become demented.
Sure.
You got to be careful with the interpretation.
You can't really do anything about it, though, right?
Well, no, but as I said, you can actually, if it looks like you might be going in that direction, that's a patient that perhaps the doctor would keep a much closer eye on. Talk about early intervention with some certain medications that might slow the progression of the disease, or even be able to get them to take part in clinical trials. It might help as well.
True.
So it's keeping an eye on those high-risk patients.
Yes.
Thank you, Dr. Max.